Today we'll be discussing about the structure of vocal cords or vocal folds. Where is this vocal cords found? They're found in the larynx, in the glottis. The vocal folds extends from the middle of the thyroid cartilage. So friend, you have the thyroid cartilage and it extends beyond into the vocal process of the arytenoid cartilage. So this is how you can see the top portion of finger. This is how it is. Here it is a thyroid cartilage, middle portion of thyroid cartilage, and you have the vocal process here. So this is how the vocal cords extend. And each vocal fold is a layered structure. It is not a single structure. It is a layered structure. And the opening of the vocal cord is known as rima glottidis. Two vocal cords come together, they can close and open. This opening is known as rima glottidis. Before I talk about the layers of the vocal cords are divided into a membranous vocal cord and a cartilaginous part of the vocal cord. The anterior 3/5 of the vocal cord that extends from the anterior attachment to the vocal process is known as a membranous vocal cord. Till the posterior 2/5 of the vocal cord that extends from the vocal process to the face of the arytenoid cartilage, that is known as cartilaginous part of the vocal cord. The vibration of the vocal cord mostly occurs at the membranous part of the vocal cord. The cartilage part of the vocal cord usually helps in supporting the vocal cord and maintaining the position of the vocal cord with the help of the arytenoid cartilages. What are the layers of the vocal cord? There are total 3 main layers for the vocal cord. So the most superficial layer is the epithelium. The epithelium is formed by non-keratinizing stratified squamous epithelium. Then below the epithelium, you have the lamina propria. The lamina propria of the vocal fold has 3 layers. I will come to it. The third layer is the vocalis muscle or the vocalis part of the thyroarytenoid muscle. So these are the 3 layers: epithelium, lamina propria, vocalis muscle. Now the lamina propria has 3 layers. So the topmost layer of the lamina propria is a space. It is a space filled with gelatin-like material that is known as rinky space. And just intermediate layer is formed by elastin fibers, and the deep layer of the lamina propria is formed by collagen fibers. So the intermediate and deep layer of the lamina propria together is known as the vocal ligament. And you should understand that this vocal ligament is formed by the pre-border of the conus elasticus. Or confused? See, you can know that the cricovocal ligament or conus elasticus extends from the thyroid cartilage to the cricoid cartilage. So it is extending like this: thyroid cartilage to cricoid cartilage, arytenoid is K. There's a free border for the cricovocal membrane. So what happens? The free border of the cricovocal membrane forms the vocal ligament. So on top of that, you have the rinky space. On top of that, you have the epithelium. Below it, there is the vocalis muscle. So all this together forms the vocal cord. That is how it is formed. No need of any confusion. So superficial layer of non-keratinizing stratified squamous epithelium. The lamina propria composed of the rinky space, intermediate layer formed of elastin, and a deep layer formed of collagen fibers. Intermediate and deep layer form the vocal ligament, which is also the free border of the conus elasticus or the cricovocal membrane. And the posterior and lateral deeper layer is the vocalis or thyroarytenoid muscle. Okay, so this forms the vocal cord. This loose areolar tissue present in the rinky space allows for free movement of the mucosa and epithelium overlaying it, and it gives the typical waveform information. So this rinky space is very important. Another clinical significance is rinky edema. About that I will come to in another class. So the mucosal space is required for the formation of the proper waveform during phonation. Also, these layers of the vocal cord are not the same throughout the vocal cord. There is difference. The anterior end of the vocal cords, that is where the vocal cords attached to the thyroid cartilage. That area where the vocal cords join together is known as the anterior commissure. So in this area, there is a thickening of the collagen fibers known as the anterior commissure tendon or the Broyles ligament. This anterior commissure tendon is attached to the perichondrium of the thyroid cartilage, and posteriorly it extends and merges with the lamina propria of the vocal cord. Lamina propria, as we learned before, contain intermediate elastin layer and deep collagen layer. Near the anterior commissure tendon, there is a thickening of the elastin layer also, that is known as anterior macula flava, and that extends into the intermediate layer of the vocal cord, because intermediate layer of the lamina propria of vocal cord is comprised of elastin fibers. Deep layer is composed of collagen fibers. There is a similar structure at the posterior end of the membrane. This is anterior, posterior, medial, lateral. So posterior end of the membranous part also similar thickening of elastin and collagen fibers are there. What is the use of these thickening? These appear as cushions. So these appear as cushions to protect the vocal cord from vibrations caused during speech or phonation. Okay. Another interesting thing that I like to share is the vocal cords are wedge shaped. That is, the height of the vocal cord decreases as it goes anteriorly. It is because the inferior border is slanting upwards. So these are wedge shaped. So it goes like this. The superficial layers of the vocal cord helps in the pliability, vibration, and the waveform. The deep layers helps in the structure, the tension, and helps in vocal fold closure. So, what is the length of the vocal folds? In adult males, the length is around 17 to 23 millimeter. In males, the vocal folds length is longer. So, longer they have a lower pitch voice. Females, the length is around 15 to 19 millimeter. So, females have a high pitched voice. I will explain briefly about the functions of the actions of the muscles also on the vocal cords. So, main function of these vocal cords is main function of the larynx. About that, I will be discussing in another video, but I will outline it now. Main function is protection of the lower airway by closing the vocal cords and larynx so that no foreign body or any food doesn't get into the lower airway. That is one. Second is phonation. Then respiration, normal breathing. So normal breathing, the air goes via the larynx into the lower respiratory tract. Then fixation of the chest. When you close the glottis, you can hold the intrathoracic pressure and helps you to lift weight and everything. So that is also another function of the larynx. So the main function of the larynx is brought about by these vocal cords. It is closing and opening. Closing and opening. So opening is known as abduction. Closing is known as adduction. If you are new, you find it difficult to remember abduction or adduction. I'll give you a tip. Abduction has B. B is broadening. That is opening. So B is broadening, opening, abduction. Adduction is closing. So how does the vocal cords abduct? So you know that it is attached from the thyroid cartilage to the arytenoid cartilage. So when the arytenoid cartilage is moved laterally, it can open. When the arytenoid cartilage comes close, it will close. So, abductor vocal cords, you have to remember, only one muscle abducts the vocal cord. That is posterior cricoarytenoid muscle. That is the only muscle that abducts the vocal cord. This muscle functions to rotate the arytenoid cartilage posteriorly and laterally and abducts the vocal cord. All other muscles abducts the vocal cord. Lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, all this abducts the vocal cords or close the vocal cords. What is the innervation of these muscles of the vocal cords? All the muscles of the larynx are innervated by recurrent laryngeal nerve branch of vagus nerve, except cricothyroid, that is innervated by the external laryngeal nerve branch of the superior laryngeal nerve branch of vagus. Okay, so what is the function of the cricothyroid? Cricothyroid, as you imagine the name, it extends from cricoid cartilage to thyroid cartilage, that muscle. So that will increase the tension of the vocal cord, elongates the vocal cord. So it helps you to regulate the pitch. When you speak high pitch, it helps to regulate the pitch. Thyroarytenoid. So the vocalis part of the thyroarytenoids is inside the vocal fold, fine tunes the tension of the vocal fold. It is inside the vocal folds and it helps to maintain the pitch during phonation. So it has an opposite action of the cricothyroid muscle. Thyroarytenoid muscle, what will happen is it shortens the vocal cord. Thyroarytenoid muscle shortens the vocal cord. What is the difference in infants? In infants, the length of the vocal cord is around 6 to 8 millimeter. And what happens in the layers? In infant, the lamina propria is composed of only the ringy space, only the superficial layer is there. So the intermediate and the deep layers form later only. The vocal ligament begins to appear at around 4 years of age and they differentiate into 3 layers around 6 to 12 years of age. And the 3 layers, proper adult vocal ligament and adult vocal fold layers are complete by adolescence. So in old age, what can happen? In old age, there can be degeneration of the vocalis muscle. There is atrophy of the vocalis muscle, thinning of the superficial layer of the lamina propria. The gelatinous layer can get thinned out, and they will have difficulty in phonation. That is known as pressed by larynx, age-related difficulty in phonation. Ligaments of the larynx, the different muscles of the larynx, and the functions of the larynx in detail, I will be talking in another class. Thank you.